Cummings. I'm a nurse practitioner. I work with the hospitalist team on the third floor of San Luis Valley Regional Medical Center. I pursued a position or a vocation in healthcare because I was interested in science. Prior to this career, I was in construction, which I enjoyed a lot as well. But I like applied science, and so I get to do that every day, apply science to my patients, and it gives me the feeling that I'm working with the thousands of scientists and providers that have gone before me. Rural care is my specialty, and I like it. That has been my focus through all my training, and I'm a member of this community. I like applying my skills to this community, and so that's why I like working rural.
My name is Kaylee Chavez Miller. I'm a family nurse practitioner, and I work for San Luis Valley Health at the rural La Jera Clinic, practicing family medicine. I wanted to come back to the Valley so that I could really help promote wellness in a global sense, not just physical but emotional, and for my people. I'm practicing in the community I grew up in, which has its challenges, but it has its beauties as well. And one is that you really have instant rapport with the people that you are working with, and you really love your patients and they love you. What I enjoy most about practicing medicine is the challenge that exists in working with people and meeting patients and families where they are in their understanding of health. Practicing in a rural setting is wonderful because you truly get the whole scope of family practice. My youngest patient is 4 days old and my oldest is 98. So we truly get to see everything within the lifespan. And given that the community is so small, you really get to know your patients, and the patient dynamic becomes very authentic, and it's fun. You can joke around with your patients. It's just a relationship that is very positive and nurturing and interesting.
My name is Orlando De Herrera. I'm a family practice physician here in the Monte Vista Clinic. So I practiced in Texas for 12 years, and always wanted to come back to the Valley. I mean, this has been home. Here in this practice, turns out Monte Vista is an older community, so the majority of my patients are elderly patients, which I do enjoy, but it is quite difficult, more complicated patients, but I love the community. I teach my patients how to take care of themselves. That's my goal. We'll bring them in, and I'll bring them in a second visit, and I'll tell them, I'm going to teach you how to maintain this and do some stuff at home. And most of my patients have really taken that in, and we've done well.
My name is Catherine O'Donnell. I'm a physician assistant in orthopedics here at SLV Health. The thing that I like the most about practicing in a rural community is seeing some extensive injuries that I feel like I wouldn't be able to see if I were in a bigger city. And we have a lot of farmers around here that get caught in certain machines that can damage their bones, and it's very interesting to see all of the injuries around here and be able to help those people. It's a great area. Everyone here is very welcoming and nice and wonderful to be around, so I just think that it's a very friendly, work-oriented environment.
I'm Carla Christ, and I'm a general surgeon. I decided to go into medicine mostly in junior and high school. I really liked sciences and how the body worked and finding out more about why we are who we are. I like practicing medicine. I find it very enjoyable. I love seeing patients get better, and especially here in Alamosa, it's been great to see patients outside of the hospital, during a parade, at Walmart. I really feel like we're a part of the community and taking care of our community.
I'm Chris Steinberg, and I'm a family physician who also does obstetrics here at San Luis Valley Regional Medical Center. Because my father was a family physician, or basically in those days a general practitioner. I spent a great deal of time in his office, both as a child being babysat, and then later when I was independent, I'd walk to his office with him and then go on to school, and then in the afternoon hang out there. So at age 11 I was pretending to put casts on people. When it came time to make a decision about a career, it was while I was writing my college application. It just came out of my hand instead of my head. Yes, I'm going to be a physician. So it was a non-decision, really, a natural decision. What I love about the rural community is that I think family physicians and other primary care providers have a broader spectrum of what they can do. My day is interesting because there are so many different things that I get to help patients with, from delivering a baby to taking care of the baby to taking care of elderly patients. I just find the variety delightful. Also, what I really like is getting to know people. As you can imagine, being in one place for the length of time I have been, I still have patients that I might have delivered their babies, and now I'm doing some early senior care, and I enjoy that so much. It's easy actually, because I remember things about their past and I don't have to work hard to figure out what's going on in some cases. So it's the continuity that I find most enticing and enjoyable.
So my name is Nuwan Pilapitia. I'm one of the family medicine docs here at SLB Health. I do not come from a family of doctors, but I do come from a family of professionals who always kind of instill the importance of education, social consciousness and awareness, and trying to give back. So those are some of the things that drove my decisions to get into medicine. And during residency, I realized that I enjoyed so many aspects of medicine that I couldn't narrow it down. So, primary care and family medicine became more of a reality for me, because I could practice more full spectrum medicine from children all the way till grandparents. So the privilege of participating in somebody's healthcare is truly something I'm humbled by. They invite me into one of the most important parts of their lives, their healthcare, and I take it very seriously. What I enjoy about being in a smaller community, practicing in rural Colorado, is the love that I receive and the love that I can, give back to the patients. I ask about their families and they ask about mine. We meet each other outside of work, and they're very respectful of my time, and I tend to be of theirs as well. One thing I really enjoyed was the hugs I get from grandparents, grandchildren, when we take care of them, good times and bad. It feels like a real family. And so, primary care and family medicine to me is all about making people better in the long run. And in a community such as this, I think we're working well together to get to that point. So.